looking at even just 2019 to 2023, our commodities requirement for family planning was around 21 million. We sort of were able to contribute around 12 or sort of 13 million of that. The amount increased to about 22, 23 million in 2023. That doubled. But then what we saw is a corresponding increase in women accessing services, family planning, and a range of services, including also sort of other maternal and childcare services, because these are linked. While yes, funding has increased, unfortunately, this has been at the expense of government not releasing its share. Actually, if you look at the same period, government commitment to family planning in terms of allocation increased. What they were committing and allocating in the budget was quite substantial over years. I think it's the spending where we had an issue about. And frankly, if our government probably would have done the same. That if there's a donor who is willing to provide funding, why would I put my funding in an area where a partner is already funding? I'll probably put somewhere where there's no any other funding. So maybe that was irrational. But was it a rational sort of decision on the basis of the need? Our needs were higher. If we look at even just 2023 budget, we needed 35 million. We only funded 21 million of that. So we actually are not meeting our needs for family planning. And I'm looking just at family planning and using commodities as a prox. I'm not looking at services because also that was spending money. But with that, it meant because we were not meeting our needs of the funding required, we see there has been, if we look at just MCPR for the last sort of 2015, we've flatlined because we have provided enough to keep pace with to remain afloat in the context of population growth. And that when you look at the census, we had 14 million women of reproductive age, and only 3.9 million of these are using family. So it's only 27%, extremely low. And our unmet family planning need has not changed. Why? Because we have not been able to raise funding that is needed to meet the requirement. So our challenge, however how good we've been, still remains significant. We've been really good because at least we didn't dip in the context of rising population. We've remained afloat, but we need to do quite a lot going forward. Now, that's where my worry comes in the future, because we need more. And sort of Melissa is telling us, and I think that's correct, there's going to be reduction in funding, whether we like it or not. Government is increasing its funding, which is really good, and we've seen just sort of in this last financial year, this financial year, substantial amount of money has gone into family planning commodities alone, which is good, but we need a lot more, especially if we are to keep up with pace with population growth. So that is a challenge, and we need everybody, and we need to look at what else do we need to do in order to continue to provide family planning. Because it's not just family planning, it's not just the commodities, it's all the services that are around family planning. And what important we need to know and see is this is not a service just because we are wanting to control the number of children women need to have. It's an investment because of all the knock-on benefits that we get when we have family planning services provided. So that's the background that we need to have. And it's about families needing to look at how are we investing on family planning, is the state, and where do we also make efficiencies on the way in which we deliver services and the way in which we are also procuring. All of these would be at play if we are to sustain the gains and also make progress, because we need to sustain the gains. We need to make sure that we are protecting, we don't lose what we've achieved, but also we need to make progress, knowing where we are at the moment.
Thank you so much. Gertrude, building on what you said, I just wanted to also thank you, because FCDO has always been at the forefront, for family planning. And Pathfinder currently is one of the beneficiaries of the funding that you provide under the Scaling Up Family Planning Program, which is led by Engender Health, and we are sub-partners to Engender Health. So we really appreciate. But, again, you are coming from a big bilateral donor, and some of us, when we look at FCDO, we always think about how can we get the money from FCDO. So I have a question for you. So considering that the demands are high and the resources are scarce, how would a fundable proposal look like, in your opinion, at this moment? What would you fund?
When there's no money, there's nothing to fund. So I'll be lying if I say this would be a good proposal, because actually there's no money going around. And I don't know if people have taken note of the UK itself has reduced its allocation to ODA. We sort of had, what they originally had it reduced in 2020 to 0.9% or 0.5% of GNI, was reduced this February to 0.3% of GNI. So that's massive reduction. Is effectively, we have reduced the budget by 40% of what we had last year. So that's quite significant. What that meant, we have less money that is available for bilateral programs. So the way in which the UK fund its international development, we put money to the multilaterals. So this is the World Bank, the WHO, UNFPA, and the like. And then we have money for the bilateral programs. So these are the countries, the individual countries that we are operating in different parts of the country, which we have 33 that are implementing international development. And we also have some programs that are managed out of London. So these will be multi-country programs that will be implemented in sort of maybe 5-6 countries or even 10 countries at a go. These are managed out of London. So as our aid has reduced, our allocation to bilaterals has reduced. One good thing we, as the UK, have remained committed, sort of 3 priorities. Global health, including sexual reproductive health, is protected or sort of remain a priority. Climate change, and can't remember what was the 3rd priority, goodness me, security. Humanitarian, yes, because we have the ongoing humanitarian crisis, is sort of, we're remaining committed to the crisis in Sudan, Ukraine, Gaza, and sort of those places. So all humanitarian sort of supports continue as they were. We'll have less money. But a good proposal is one that responds to the terms of reference. That's what I would say. Don't do anything that the terms of reference hasn't asked you. If you are responding to a terms of to a proposal, absolutely make sure that you understand what they ask, and then respond to this.
Thank you. That is not disclosing enough. So, thank you.
But I think in linking to your point around what you asked, Dr. Makwani, you're saying government, sort of you're seeing sort of discussion with government, and where is the space for NGOs, sort of civil. I think there is enough work for all of us. We need to identify the added value of civil society in this context and what we are bringing to the table that government isn't doing. Governments must provide services. That's their responsibility, and they need to do it better across the country. How do we make it that they do even better? What is it that we are bringing that government isn't able to do that would complement its service? We shouldn't be substituting government ability to deliver services. That is not building our state capability. Building our state capability is that it does what it needs to do better. We need to bring more than what they should be doing. We shouldn't be fighting on service delivery at all.
I like how you said that there is work to do for everyone. You know, there is a lot of work to do for everyone. And talking about CSOs, I want to come to you, Dr. Isiaka. You are from Pathfinder, and Pathfinder being a US-based organization, being an American-based organization, at a global level, is one of the organizations that has been badly hit by recent changes in the, at USAID. But I know Pathfinder, you are committed to a mission. You have a mission and you are committed to it. So given those circumstances, what are you doing to sustain your SRHR work in Tanzania and beyond? And what lessons do you have to share?
Yeah, thank you very much, Dr. Joseph, for your great question. So it's true, Pathfinder also has been hit nicely, with with the funding cut, and so we've taken a number of steps to make ourselves relevant, to make sure we are able to sustain the gains we have made for over the years. For example, just for the information, Pathfinder has been operational in Tanzania since 1959, so for more than 60 years, so you can imagine. Yeah, so we've taken a number of actions. Number one, we have reviewed our structure. We are reviewing our systems to ensure that we are being more efficient. So operational efficiency, that has been one of the things that we've been focusing on. And again, in relation to funding, resources are very important. We've been also focusing on intensifying our efforts to diversify our portfolio of funding, not only be dependent on one donor. And some of the country, Pathfinder country, globally, some of them were a little bit ahead and some were a little bit not doing that much good. So we find that in some few countries, of course, we were unable to sustain them. But in a number of countries, I think out of 22, we've been able to sustain programming in 16 countries. So it's something which is significant. Another area that we've been focusing on is expanding, our partnerships, trying to engage partners who are working beyond health sector, engaging some of the untraditional partners. So in enhancing efficiency, as I've said, we are reviewing our processes internally. For example, some of the global functions have been moved to country level, and now we are pushing for country-to-country collaboration for technical assistance, because, of course, we have some resources sitting in DRC, for example. We have some resources sitting in Burkina Faso. So how are we leveraging those, to keep, keeping advancing SRH globally? So that's something that we are doing. We are discussing also about how can we leverage AI. So it is something that we are still discussing, because it's also another area that we think it can help in improving efficiency in the work that we are implementing. But at country level, for example, even in Tanzania, so we have been reviewing our implementation models. So pushing towards integration, for example, integration from program management to implementation level. So some of the projects are being, have been combined, and they are being managed, let's say, by one person. But of course, when it comes to delivery, for example, we have a project in Morogoro, we have 2 projects in Morogoro. They are focused on SRH. So we are trying also even to integrate the implementation of the activities that is grassroots level. So these are the things that we are doing. Yes, thank you.
So you have 7 active projects up and running in Tanzania, and
who told you that, Doctor?
And some of them are national level activities.
Yeah,
what I'm more interested in hearing from you is, how are you ensuring that your vision and mission towards SRH is not lost, in this context?
Yeah, so as I've said, partly I think my response to the first question, very much responds to the current one. So those are a number of things that we are implementing. So first of all, we have not changed our vision and mission, just to communicate that and make that clear. So we have not changed our mission. And what we are doing is to adapt, in this current context, to make sure that you are able to deliver, to advance SRH, in Tanzania and beyond. For example, some of the action that you are taking is looking at innovations which can help advancing SRH, but at a low cost. So we have exploring, and we've started actually implementing some projects using the social enterprise model. So we have done that. So in Tanzania, because we are part of the M-Mama project, so M-Mama basically deploy the social enterprise model where the community are also involved in addressing the social problems. But also in other countries also, like in Egypt, we have implemented that kind of a program. So we are trying to push for other countries also to learn from these initiatives and see how we can continue advancing SRH globally.
Thank you. I have a follow-up question for you. So if you had an opportunity to be in the same lift with a donor, what would be your elevator pitch?
Yeah, so thank you very much. Thank you very much. Fortunately, I'm on the same, panel with the donors here. Yeah, so basically I think one thing is, it's undeniable that globally we have made such a tremendous gains in advancing SRH. And talking specifically about Tanzania and some of the African countries, basically withdrawing, funding abruptly the way it has been done currently, and actually stop financing SRH, basically will reverse the gains that we have made. For example, right now we are sitting at an opportune moment to reap demographic dividend. Most of these African countries, have, big portion of population, of youth population. It's a working age population. So if we withdraw investment now from them, basically we'll be going back. And over these years as well, for example, specifically talking about women and girls, for example, so through SRH, a lot of women have been empowered, and it has enabled them to engage in socio-economic activities, enter the workforce in the market, and also participate in the economic development activities. So actually stopping now, I think, would be a very, it's something to really think deep before you say you cannot continue funding SRH globally.
Thank you. You had a long, how do I say it? We are going maybe to the 70th floor, your elevator pitch. Thank you so much for those insights, and I really appreciate, the way you are navigating, the new normal on the ground, making sure that SRHR is being integrated in what you do. I want to go to the audience, but before I turn to the audience, Melissa, I have one more question where I would like to hear your views, especially based on Dr. Makwani's intervention around, donors talking to the government more, restoring the equilibrium, between government and non-government sector, So I would like to get your perspective around that, and particularly if you can share, why do you think this is happening now? Why now? Why not yesterday? Why not 5 years ago? Why now?
Okay, thank you. You asked the question to donors. UNFPA is not a donor.
And again,
multilateral.
Let me clarify that.
Yes.
The reason why I asked that question to you, because from your angle, from where you stand, where you sit, you look at everything. You look at funders, you look at governments, you look at bilaterals, you look at multilaterals, you look at private sector donors, foundations. So why now?
Yes. Okay. No. So I think it has to do with exactly what we're saying here, because of the gaps, the funding situation, and the significant reduction in funding. I think a couple of things have come on the table. One is the issue of sustainability of interventions, of results. Sustainability has always been an issue, and I think, any program and any bit of work that is being done in country, there's always a concern and a push around sustainability. And I think there is, within the context of declining funding, there is a shift in some instances to working a lot more closely with the government, so that some of these results and some of these initiatives can be better embedded into national structures, right? So I think sustainability is one key issue, and scalability as well, right? Because as Gertrude said, it's the government's responsibility to deliver on these services, obviously in collaboration with other partners. But I think the concern, or the part of the drive, is around sustainability and ensuring that governments are sort of playing a key role so that these initiatives can be sustained, so that they can be scaled as well. Because again, it's government that has that overall sort of landscape and framework for scaling up. I think the other element would be accountability, right? And so, you know, obviously our INGO partners play an important role in this space, and I think Gertrude said it well, and they're the, you know, the comparative advantages that you have, Pathfinder, MSI, CARE, etc., that the government may not have, and I think we have to recognize that there are strengths, right, and therefore it's the collaboration that is important. But I think in terms of accountability, it is government that has made commitments on various issues. There's FP 2030 commitments that the government has made in terms of certain commitments around universal access to sexual and reproductive health. There are targets on family planning. There are targets in terms of unmet need. The government has made those commitments, and therefore I think a part of that increasing focus on engaging with government is to reinforce that accountability. The government has also led and established policies that sort of provide a framework for delivering on some of these commitments. And again, it's the government that is accountable for these areas. And therefore, I think a part of that shift or increasing emphasis on working with and through the government is recognizing the importance of the government in terms of sustainability, scalability, and accountability. Because at the end of the day, whereas, you know, civil society and INGOs have a critical role to play across several areas, it's the government that is accountable for delivering on these commitments and delivering for the population. And I'm very happy, you know, Dr. Makwane mentioned earlier, in Vision 2050, DERA 2050 that was launched, we're very excited to see that one of the aspirations under the pillar on human and social capital is universal access to sexual and reproductive health and education. The government has put that in the Vision 2050. So it means, therefore, there's a commitment and there's an accountability. So I think it provides us with a good framework and a good opportunity through which to continue now to work with the government, to push, and for partners to collaborate. Because if we've committed, if government has committed to delivering and to aspiring to universal sexual and reproductive health education for the population, then it means there has to be support to have that materialize, including funding, including ensuring that those services are reaching every woman, every young person, every family across the country. So I think those would be the reasons why I would see the shift or increasing focus on government. But notwithstanding, the partnership with INGOs is critical, because there is space, there is more than enough work for all of us to do, and certainly that collaboration and integrated efforts will only serve us better in terms of delivering on those results.
Thank you. I really appreciate, you know, particularly where you ended, you know, that the contribution and the partnership with the international and local NGOs is very important in making sure that, you know, the gains are being sustained. Yeah. So we are actually doing very well with time. We have 30 minutes remaining from the time allocated to us, despite that the previous session was a little bit longer. So don't worry. When Melissa was speaking, I saw Dr. Makwane and Gertrude, you know, nodding their heads very strongly. And I don't have a question for you, but I just want to ask you for just 1 minute, what was in your mind when you are nodding? Before I go to the audience, something excited you from Melissa's intervention?
First and foremost, I would like to say,
yeah, we can hear you. We can hear you.
First and foremost, I would like to say that the government has accepted the challenge.
2 minutes, 2 minutes.
But it has not dropped any interventions which is life-saving, which is ensuring there is a transformation, there is a survival. All of the interventions are taking place in the country. Maybe I made one comment that I want to clarify. You heard from Madam from FCDO here saying that the government is to answer the call for its people, service delivery. There are some challenges that we can address in a partner world. One of the challenging area in partner world when you provide resources is a cost of running the organization is huge. compared to the government, especially the government of Tanzania. And I can just give you a quick example. There was one funding which was passing through one organization. They were taking 30%. And then that fund goes to the beneficiary. 30%. At one point we spoke with the fund and said, we told him, 30% is not acceptable. After some time, that fund was withdrawn from that party, and it went directly to the organization which was implementing. So we need to look at our offices, how we can reduce the
Overhead cost.
costs.
Yeah. That Gertrude,
And that has
why
been
were you-
addressed. That's why you can see there is this divergence towards the government.
Okay. Gertrude, in 1.5 minutes, why were you so happy? What was in your mind?
Well, I think we need to be honest with ourselves. In some house, the ways in which we've delivered development interventions for the last 20 years has also done harm. We've, in some instances, created parallel governments through the work we've done with international development partners. And it's time we make that shift. Because the withdrawal has actually exposed us. And had it not been that government moved in quickly to try and address some of the issues, we were heading towards a catastrophe. And I'm not saying that we're out of the woods yet. We will go through a transition where things will not be as they were. But it's really good to see, and I'm saying this with really pride, government stood up quite quickly and stepped in critical services. This is not to say that civil society, NGOs, do not have a role to play in these sectors. And I'm overseeing education, health, social protection. They are critical roles that we can play and can work with government. They are technical expertise that we can bring that government isn't able to do. There are areas that government will not be able to do. What are those areas that we need to be able to do so that we collectively can save better? And that's where we need to be making those shifts. We need to acknowledge the role of each of us.
Thank you. So now it is time for the audience, to participate and ask questions. Please, nyosha mkono. Be specific on who your question is directed to. Try to be brief, so that we have, opportunities for many people. We will take 5 questions. I will take 2, 1. So from here, I will start with Patrick.
Okay.
And then I will start with Dada pale nyuma. And then Dada hapa na nyuma yake kaka. And then from here, Dada Wema. Okay. Karibu sana. Let's start with you, Patrick.
Asante. My question is to Dr. Makuani. So just checking with you, given the context and what Dr. Joseph has shared as well, a lot of funding now is flowing through the government, and you've shared your worries, the overheads and all that. But we understand the government, although you're saying efficiency is improving in terms of delivery and all that, but there is that necessary bureaucracy which is there. So sometimes things can be slow, but it's necessary, we understand, because of resources have to be managed properly. Do you foresee any circumstances whereby you may enter into agreements with NGOs to provide some of these services? We understand, for instance, in terms of health services, there's service agreements. But do you foresee any circumstance whereby maybe Maristops could get some resources to provide outreach services in these circumstances? Just a question. Thank you.
Thank you. Pale nyuma.
Thank you so much. My question goes to Dr. Makuani. I'm aware that government has done tremendous work in supporting filling the gap of USAID, and this has led to 1% to reach the compact agreement of 1% in 2023, 2024, 2% 2025, 2026. So my question goes like this, and I know in 2021 the government as well has committed under FP 2030 10% annual increase in domestic funding. So my question is do you have any plan to ensure that the 10% is also met? Thank you very much.
Thank you. Dada Pale.
Thank you so much. My name is John Rozoska. I'm a public health student from the University of Dar es Salaam. And my question goes to Dr. Makwani. Thank you very much, first of all, for being transparent and accepting, taking accountability kwamba kweli right now we have fundings that are short. Sasa, with donor funding for SHR, RH declining, now the whole integrating it in the Vision 2050, what practical and innovative strategies can Tanzania adapt to ensure sustainability? Maybe from our very own resources, but then in particularly to reach adolescents and youth who are most vulnerable, but are not able to, receive the services. And my second question, I have two questions, sorry.
One, please, we'll come back to you. So, hapo nyuma, dada, and brother pale, brother. Brother, site savers, From site savers, Yes.
Thank you so much. I'm Edwin Maleko from Site Savers. My question is to Dr. Makwani, and I just wanted to know if there is any cost study that were conducted on SRH, so that we can say this, the amount that the government is allocating is enough. I'm asking this because in our outgoing health sector strategic plan 5, it says that we need about 348 billion this year for maternal and reproductive health. So maybe you can highlight how did we arrive on that amount, and if there is any study. Thank you.
Okay, and Dada Wema.
Sorry, Dr. Makwani. I can't ask my previous boss any questions. Yeah, so with this new paradigm that we're seeing, we're anticipating, of course, the more impact will be on adolescents, especially the 10 to 14 or 15 to 19. Okay, so there's limited access to contraception. So if I was a healthcare provider, I'm not one, I would probably prefer giving it to an older woman than giving it to an adolescent, because of thinking this adolescent can abstain and etc. and should be in school anyways. So I know you've been working with the Ministry of Education. What insights or what strategies do you think you can further make them understand this new paradigm in terms of further pushing the re-entry policy or dissemination of the entry policy in school, but further also thinking of what the numbers will look like in terms of dropouts and teenage pregnancies? So what new do we anticipate in your collaboration that you already have with the Ministry of Education in terms of comprehensive health education and the et ceteras? Thank you.
Thank you. Thank you so much. Pole sana, Dr. Makwani. So I'm going to give special preference for 2 more questions to other speakers. So ambaye nataka kuwauliza Dr. Makwani asinyoshe mkono. So I would like a question for Dr. Isiaka, for Dada Melissa, and for Dada Gertrude. And I will start from Eric. Dr. Eric, karibu. I was actually surprised that, Eric, you have not put up your hand.
No, maybe a question.
I was getting worried,
Thank you, George. Maybe a question to Gertrude, where you very rightly said that the service delivery is a government responsibility, and many of the NGOs in the past, their members have gone much their own way in setting up vertical structures. True. However, we have also seen that a number of NGOs, CBOs, they have worked with the government to ensure that quality component. And that quality component, Ahmed very, very rightly said, the commodities, that is vision and our overall view and the strategic framework, that's our business. But we may need, in the service delivery, we may need some assistance in providing quality to all the commodities we have. Now, how to do that when so many of these NGOs have had so many lays off in staff, and some have even disappeared? So what is the role of the CBOs, in particular CBOs and national NGOs to assist wherever possible that little bit of quality which just made the change.
Thank
It
you.
is very much appreciated by our population.
Thank you, Dr. Eric. That is for Dada Gertrude. Who was the other one? Nani alikuwa na swali lingine ambalo alienda kwa Dr. Makuani? Okay, brother hapa. And who else? One more. Okay, Dada pale. Okay, then we'll. Oh, sorry, brother pale na Dada pale. Yeah. Yes.
Okay. Thanks, moderator. Yeah. So I think across all the panelists, they have talked about being efficient in our programming at all levels, this delivery even to policy level. And I just want to hear their perspective. I think we've talked about integration from way back, and I don't think we've walked the talk. So I guess my question is just to get a perspective, what are the practical things we need to do at all levels to make sure that when we talk integration, we actually do integration and harness all the efficiencies we're talking about?
Thank you. And that will go to Dr. Isiaka. Brother Pale.
Thanks very much. I'm from to the community. My name is Walter Mia, and the people you want to save them, that's why I'm represent them here. My question for Dr. Isiaka, since you've been done this work for the SSRH, what's the strategic for the inclusion of the youth with a disability? We have children with hearing impairing. With this technology, how do we deliver the education to them for SSRH? Or if you ever done that, which methodology do you use it to deliver that education? Thank you.
Dada Pale, please be brief.
Yes, please. Thank you. My name is Emily Mfanga, a medical student. I'm navigating a mission to bridging grassroots initiatives led by youth and key stakeholder dialogue rooms such as this one. Now, my question is, beforehand, let me thank Madam Bear and Dr. Isiaka for acknowledging the role of youth, and for Dr. Gertrude for telling us about what a good proposal should have. Now, young people, we are falling victims in the gaps provided by services under SRHR, and how are we going to be included not only as beneficiaries but as equal partners in ensuring sustainability in the new plans that we're talking about?
And that question goes to?
Any member of the panel.
Okay, sawa. So we'll start from Dr. Isiaka and we'll go around like this. So please be brief. Dr. Isiaka, please respond question around integration.
Yeah, so I hope I'm heard. So actually, this question, I don't have the answer, doctor. So that's my previous boss, by the way. Yeah, so I don't have an answer to that, but it's true. So, for example, as I've shared earlier, from the program management, I think one of the biggest gap, now talking about, let's say, from my experience working here in Tanzania when it comes to integration, and I think most of us as stakeholders in the sector are aware of the issues, but one big issue that I have seen when it comes to integration, I think the problem is more at central level. That's what I would say. You know, we have these programs and we find ourselves most of the time, you know, managing these programs vertically, because when you look at our system, for example, here in Tanzania, when you go to a lower level facility and you talk about integration to only this one healthcare provider, sometimes it doesn't really make sense. It doesn't really make sense. So I think that's one of the issues. So the way we try to address it from Pathfinder angle, as I've said, so right now we are trying to integrate projects and manage them on, you know, on thematic areas. That's something that we are trying to do. So one program officer with the relevant expert will be given, you know, even a number of projects to manage as long as they are falling under the same thematic area. But also, if it is possible, and that's what we are trying to do, that has been our approach, to try as much as we can when we write, for example, when we're designing a new proposal, trying to embed it in an existing work that's going on. So that's something that we're doing for this end. And on disability, so because I've been also asked about disability, so when it comes to disability programming in Tanzania, especially in the area of RMNCH, I know the government is taking a number of action, but I think we still need to invest more, because disability is broad. You have vision disability, we have some physical disability, hearing disability. So talking from a sector perspective, for example, in the number of projects that I've been involved in implementing, really we've been more trying to address it from healthcare providers' attitude. That's something that we've been trying to address. And we believe once you make healthcare providers aware of these issues, of the issues that people who are living with disability are going through when they come for services, it will make them take appropriate actions. Even issue of improving infrastructure, which is one of the biggest issues people are talking when you're talking about disability. It can be improved what the healthcare manager of that particular facilities is aware that we should design our facility in such a way that is disability friendly. So we have been approaching it more from the workforce perspective. That's what I would say from my own experience. Thank you, Dr.
Thank you so much. So we go to Melissa. Welcome.
Thank you. So I think the question was what is being done to include young people more in the SRH? Okay, so I think there are many things being done at various levels, but there are still gaps, right? And I think it's critical because, as we know, young people in Tanzania constitute over 60% of the population below 24 years. So we talk about young people being the future, but certainly if there is no investment in young people's health, education, empowerment, skills generation, then all of these aspirations that Tanzania has could come crashing down if young people are not empowered and are not participating actively in their own development process and the development of the country. So I think there are things happening at policy level, lots of advocacy. There's a youth development policy. There are various policies across the sectors. There's a NIA. So there's recognition at a policy level. But there's also work being done at community level. There's a lot of programs. Even UNFP, we work quite a bit with various partners, including partners here in the room, on empowering young people with sexual and reproductive health information, education, complementing that as well with income generation and life skills so that we can see young people's holistic development. So there's quite a bit of work taking place. The issue is, of course, I think, and the point came up, it's integration. So there are gaps in the integration of those efforts. There are gaps in terms of how those interventions are sustained. There's a lot that still needs to be done in terms of community engagement and engaging health sector providers and to address issues of discrimination, issues of certain norms that still alienate young people from accessing services, issues around discrimination. So there's a lot to do around gender and social norms. And it's important, as you said here, that young people themselves, you as young people, that you continue to advocate and assert and ensure that you are a part of that conversation. And I make reference to Vision 2050, and I think it's a policy document, but unless young people are actively involved in the implementation, then this country cannot achieve the lofty development aspirations that it has. So you have to be front and center in the conversation, working with the partners who are working on your behalf. I think young people, and particularly young people with disabilities, always say, nothing for us without us. And I think that has to be the approach for young people being actively engaged in the process. But the short answer is that there is work going on, but there are gaps, and we need your voice and your inputs to ensure that the programs that are being developed and implemented are adequately addressing your needs to ensure that you are achieving your full potential.
Thank you. Dr. Makwan?
First of all, I should underline
combine the questions and answer them at once.
I should underline the fact that in the last 10 years, and even these 5 years, the government has been very, very efficient. And we've managed to move the country from the time when we were saying, where I'm going to get the services, to a point whereby what quality of service can I get? Because that question of availability is done. And it has been done in a very efficient way. So when it comes to efficiency of service delivery, I would say we have shown that the country has attained the largest milestone in terms of improving efficiency. Part of the question was whether we can recommend the NGOs to some of the services. The moderator himself here, we have recommended him to one of the services recently.
Yes. Thank you.
And he cannot deny it. We have recommended him to one of the services. And many, many partners inside here, recently we recommended them to some of the services. And we were writing this, we were stopping every work to ensure that we meet the deadlines. And to some of the funding agencies which have arrived in this year, in this country, to some of the partners, and some of them may be inside here, we have recommended some of the key components as well. So the government understands the importance of having the non-state actors to be part of the process. There is a set of questions on financing. First of all, we do research on financing. And resource mapping is one of the studies which is being conducted in our ministry. Let me tell you, I don't want to participate in resource mapping because many of the partners don't want to disclose what they have in their pockets. That is the truth, I can say. That is the truth. When you go to partners and you ask them, disclose your resources, I tell you that question is extremely, extremely difficult for them to take. The other area is whether there is a possibility of increasing the SRH financing. You have heard from Gertrude here. She has spoken it. The government has shown. And you can see the overall health sector budget is being exponentially increasing year by year. It has increased year by year from the time when we are getting less than $1 trillion to now we are getting $2 trillion at least. So the budget has been increasing, and fortunately the dollar also has been stabilizing somehow. The other issue you can see also, if there is a sustainability, you have heard about universal health insurance. The start of universal health insurance is to ensure there is a sustainability in financing of Tanzanians. Because finally, it is how you provide the service to the people. Is it out of the pocket, or the insurer takes care of it? So we are addressing that challenge as well. Whether strategies with the Ministry of Education, we are working with the Ministry of Education. How many of you have heard or have read the NAHIA? NAHIA, you can raise your hand. NAHIA, it has been, is a document that was signed by various ministries, including the Ministry of Education. And so they've subscribed to it, meaning that they agree to key interventions, which include prevention of HIV among young people, reducing teenager pregnancy, issues of reducing school dropouts, and also providing enabling environment for them to economic development. That's why you can see the VETA is gaining a lot of traction. And some of you are joking whether when you were told that graduates go to VETA, you are saying, a graduate to go to VETA. But that is a way to go. In the first world, to be sincere, polytechnical schools are the key for the development, are for the key of, for the economy. So let us work with the government in this area to improve the polytechnical. Because we can have many graduates in the streets, but if they don't have the skills to add to our economy, they are useless graduates. So let us all of us join hands to make sure we get use of these VETA schools. I submit.
Thank you. Nada Gertrude.
So mine was on the civil societies, FBOs, CBOs, what would be their role. They have a role, and their role will be complementing them. So exactly on quality, they can be demonstrating effective ways of improving quality and can work alongside government, demonstrating technical support in niche area that government is perhaps currently not delivering, on advocacy, but on demand side as well. We have a lot to bring to the table, and I think we shouldn't be shy of, because the challenge is it may be difficult to demonstrate those areas, but we need to be, this is the time we need to bring them out of the briefcases that we have, because that's what would make the difference. And my aspiration is really to see we are shifting to a situation where it's the government that provides money for the CSOs to work with the government. And that is where we would see our comparative advantage, because they don't have everything. We have something that we are bringing, and that is important. Because doing service delivery alongside government is an easy one, but let's do the difficult one, then that demonstrates our comparative advantage.
Thank you. Thank you so much, Gertrude. We are at time, and I can see we are standing between you and lunch, and some people are already getting a bit nervous. So let me take this opportunity to thank you, the panelists, first of all, for making time today. I know all of you are very busy people. And also, thank you to the audience, for staying back until the end and for choosing this session. Some key takeaways, you have heard from each of the speakers, the paradigm is shifting, the new normal has started. Collaboration is very important, integration is very important, and international and local organizations has a role to play in demonstrating comparative and competitive advantages to support government work. So nawatakia chakula chema. Asanteni sana. So we are going to take a group photo. The speakers, na yote yule ambaye anapenda kudandia hii picha anaweza kaja.
Okay, sorry. Sorry for interruption. On behalf of Tanzania Summit, we have special award to Pathfinder.
It's too close. And that is why we have to make sure that this happens in that way. Yeah, thank you very much for listening.